Hello friends, this video is specifically for our new MBBS students who have just joined the MBBS course, that is for our first year students. In this video we are going to be talking about the new curriculum which has been launched and which is being executed from this year. Now, a lot of our young students who have just joined the MBBS curriculum course are somewhat confused, and they are completely at sea how to go about studying about this new curriculum. Previously, we used to get a lot of guidance from seniors that which topics are important, what to study, when to study, which part is more likely to come in the exam. But again, with the introduction of the new curriculum, the seniors are also not very sure about what to do and how to do the study. So I'd like to talk a little bit about the new curriculum, what is the implication of the new curriculum, and how best to go about preparing for this changed scenario of the curriculum. Now, the most important thing you have to understand about the new curriculum is the new curriculum talks about integration. Now, there are two types of integration that the new curriculum talks about. It talks about the horizontal integration of the subjects. It talks about the horizontal integration. Okay, what the horizontal integration means? Suppose I am talking about liver. I am teaching you the topic of liver. So at the same time, the other departments, the anatomy department, the physiology department, will also be talking about liver, maybe at the same lecture or maybe in the continuous series of lectures, so that when we are talking about liver, we discuss the anatomy. We discuss the anatomy. We discuss the physiological functions. In physiology, we discuss the physiological functions, and simultaneously, either in the same lecture or in the series of lecture, we also talk about the metabolic activities. For example, bilirubin metab, for example, xenobatic metabolism. At the same time, we talk about the various biochemical tests which are used to assess the liver function. In other words, we talk about the liver function tests, where we mention certain enzymes which are produced by the liver, certain metabolites which are coming from the liver, like proteins which are coming from the liver. So, in brief, we talk about the anatomical, physiological and biochemical aspects in the same series of setting, which is going to make up the horizontal integration. The idea is to give a wholesome picture of any system that we are talking about. Any system that we talk about, we should give the wholesome picture to the student. Now, please understand that several colleges were already doing this horizontal integration. The lecture schedule of the anatomy, physiology and biochemistry will generally have a similar focus on the system. Similar systems are being covered in the different subjects as far as possible in quite a few colleges, because the concept of horizontal integration was introduced quite a few years back, and it was being implemented gradually in quite a few central colleges and some government colleges. So some of your seniors might already be knowing about this horizontal integration because they went through this horizontal integration. Now, at the same time, along with horizontal integration, now there is talk of vertical integration. There is talk of vertical integration. What this vertical integration means, that in addition to the normal details about a system, we should also talk about the diseases. So, if we are talking about liver, we should talk about the diseases which affect the liver. We should talk about the clinical findings when a person is having a disease which affects the liver, means we should talk about the complaints that the patient will give us. We'll talk about the clinical, we'll talk about the results of clinical examination, what all you are going to find when you examine the patients. So this will make up the complete scenario, not only the normal but also the abnormal, that is the disease state. So first the wholesome picture of a normal system, then the wholesome picture of a normal system in the clinical scenario. What are the associated disorders, how the patient is going to present to you, what are the findings you will see when you do the clinical examination, and we already talked about the lab findings and that are there. We can add the imaging findings, what we'll find when you do the radio imaging or you do the ultrasound. So like that we can add the clinical aspects to any scenario. Now again, several colleges are already doing the vertical integration. Whenever we talk about a system, for example, we talk about the liver, then we tell you which are the common diseases which will be there if the liver is affected, whether the infectious disorders, the inherited disorders, or if there is obstruction, there is carcinoma. We talk about that. We talk about the associated lab findings. So the app that we have, the DBMCI app, which is available for biochemistry, even for anatomy and physiology, is actually following the guidelines that has come in the new curriculum and which talks about the integration. So all our topics that we've discussed in the subjects of whether it is anatomy, physiology or biochemistry, we have talked about clinical aspects wherever they are applicable. We have talked about the associated disorders where they are applicable, what will be the most likely clinical presentation in these scenarios. We have talked about the physiological and anatomical aspects wherever they are relevant and wherever they are required. So if you look at our app, it is actually already complying to the requirement of the new curriculum. So it can be one ready tool for you to prepare for your first year exam itself. It has the horizontal integration, it has the vertical integration, and it is a very concise tool. In a limited number of time, you are able to quickly go through the most important topics which are commonly asked in your university exam also. We are also likely to add the practical sessions which are applicable for each subjects, which will further help you in preparing for your university exam. So just to summarize, the new curriculum talks about integration. It talks about the horizontal integration as well as vertical integration. Horizontal integration meaning the overlap of subjects, the anatomy, physiology and biochemistry for any system, and vertical integration means the clinical implication of a system. What are the different diseases, what will be the abnormalities, what will be the changes in the normal findings which will be there. So we already have the ready-made solution for you, and you need not worry about the new curriculum. If your seniors are not able to give you a correct guideline about that, you are most welcome to make use of the ready-made solution and the app-based video lectures which are available for you, and you can go through them to get a very clear picture what is expected from you. Thank you very much.
Hey guys! We hope you liked the video. So like, comment and share the videos. Subscribe to our channel and hit the bell icon. Stay aware!